Good day all. Welcome to Prajna One Night. One of the important topic updated by Ministry of Chemical and Fertilizers that Nafithromycin, country's first indigenous antibiotic. It's a very important topic as far as concerned. Nafithromycin, country's first indigenous antibiotic. Crisp details on the topic. This is a press release by Ministry of Chemical and Fertilizers through Press Information Bureau, Government of India. Here's a quote. The success of Nafithromycin is a testament to India's growing capability to develop home-ground solutions for pressing healthcare challenges, said by Union Minister Dr. Jitendra Singh. About this Union Minister Dr. Jitendra Singh and Minister of Chemical and Fertilizers, all the all in details we will see in our playlist of our ministries. Okay, then go to next. India's first indigenous antibiotic, Nafithromycin, for resistant infections, mainly focus on pneumonia um, type of infections. So let's go to the matters. Antimicrobial resistance has long been a growing global concern, with pharmaceutical companies striving to develop new medicines to combat it worldwide. Despite years of challenges and relentless effort, a big breakthrough has finally emerged. After 3 decades of research and hard work, 3 decades, 13 years of research and hard work, India has led the way with the creation of Nafithromycin, the country's first indigenous macrolide antibiotic. This remarkable achievement marks a pivotal moment in the fight against antimicrobial resistance, showcasing India's growing capabilities in pharmaceutical innovation. If we look on India's fight against antimicrobial resistance, then antimicrobial resistance occurs when bacteria, viruses, fungi, and parasites no longer respond to antimicrobial medicines. Antimicrobial resistance may write as AMR in a short form. Okay. As a result of drug resistance, antibiotics and other antimicrobial medicines become ineffective and infections become difficult or impossible to treat, increasing the risk of disease spread, severe illness, disability, and death. While antimicrobial resistance is a natural process driven by genetic changes in pathogens over time. Its spread is significantly accelerated by human activities, particularly the overuse and misuse of antimicrobial drugs in humans, animals, and plants. Antimicrobial resistance has become a major global health issue, with around 6 lakh lives lost in India each year due to resistant infections. However, India is making significant strides in addressing antimicrobial resistance, particularly through the development of new drugs. Nafithromycin, developed with 8 crore in funding under the Biotechnology Industry Research Assistance Council BIRAC, Biotechnology Industry Research Assistance Council, Biotech Industry Program for Phase 3 clinical trials. is a key milestone in this effort. Since India carries a large share of the global pneumonia burden, introducing Nafithromycin is especially important as there have been no antibiotics in recent years. Nafithromycin offers improved patient complaints and is a vital step in combating antimicrobial resistance. Nifithromycin milestone for public health. Let's be going to okay. Nifithromycin Nifithromycin was officially launched on November 20, 2024 by Union Minister Dr. Jitendra Singh, developed by Work Hard with support from the Biotechnology Industry Research Assistance Council BIRIC. Nifithromycin, marketed as MICNAF, spelling MIQNAF, MICNAF, targets community-acquired bacterial pneumonia (CABP) caused by drug-resistant bacteria, which disproportionately disproportionately affects vulnerable populations such as children, the elderly, and those with compromised immune system. This groundbreaking antibiotic is 10 times more effective than current treatments like azithromycin and offers a 3-day treatment re- regimen, significantly shortening the recovery time while improving patient outcomes. Nafithromycin is designed to treat both Nafithromycin is designed to treat, not treat. That correction. Designed to treat. Designed to treat both typical and atypical drug-resistant bacteria, making it a crucial tool in addressing the global health crisis of antimicrobial resistance. It boasts superior safety, minimal side effects, and no significant drug interactions. Navithromycin's development marks a historic milestone as the first new antibiotic in its class to be introduced globally in over 30 years. The drug, which has undergone extensive clinical trials across the US, Europe, and India, has been developed with an investment of 500 crores and is now awaiting final approval from the Central Drug Standard Control Organization (CDSCO), Central Drug Standard Control Organization. This innovation exemplifies the power of public-private collaboration and underscores India's growing capabilities in biotechnology. Nafithromycin's successful introduction represents a major leap in the fight against antimicrobial resistance, offering hope for treating multi-drug resistant infections and saving lives worldwide. The main fact is this is key highlights of the nafithromycin, 10 times more effective compared to azithromycin, broad spectrum action, target drug resistance bacteria, superior safety, minimal side effect, historic development, first new antibiotic in 30 years. Government's other initiative to combat antimicrobial resistance. Other than developing nafithromycin, the government of India has taken significant steps to combat antimicrobial resistance through a series of strategic initiatives aimed at surveillance, awareness, and collaboration. These efforts focus on enhancing AMR containment, improving infection control, and fostering national and international partnerships. If we goes through this slide, we can see World Health Organization Global Action Plan on Antimicrobial Resistance. Their key objectives are raise awareness, enhance communication, education, and training, strengthen research, improve surveillance and evidence base, prevent infections, promote sanitation and hygiene measures, optimize use, ensure judicious use of antimicrobial microbials in health sector, invest in innovation, promote sustainable investments and new solutions. Okay, surveillance and reporting. National surveillance networks, including laboratories across the country, have been established to generate annual microbial resistance surveillance reports with data submitted to Global AMR Surveillance System, Global Antimicrobial Resistance Surveillance System. Next, awareness and training. Awareness material on the judicious use of antimicrobials, hand hygiene, and infection prevention have been developed and shared with stakeholders. National guidelines on infection prevention have been launched and a Train the Trainer program named Train the Trainer program has been conducted across all states and UTs with ongoing cascading of training at the state level. Judicious use of antimicrobials. To promote responsible usage, surveillance of antimicrobial use has been initiated at tertiary care hospitals. National Action Plan on Antimicrobial Resistance NAPAMR National Action Plan on Antimicrobial Resistance launched in 2017. The NAPAMR National Action Plan on Antimicrobial Resistance aligns with the Global Action Plan on AMR. The plan has been implemented across multiple ministries and was initially set for 5 years. NAPAMR National Action Plan on Antimicrobial Resistance 2.0 Development. National consultations were held in 2022 across sectors through human health research, environment, animal husbandry to develop NAPAMR 2.0, which includes SWOT analysis and recommendations for AMR research policies. Redline Awareness Campaign. The Ministry of Health and Family Welfare launched the Red Line campaign to raise awareness about the dangers of using antibiotics without a prescription. The campaign advises the public not to use antibiotics marked with the red vertical lines unless prescribed by a doctor. ICMR guidelines. Indian Council of Medical Research has issued treatment guidelines to regulate the use of antibiotics, especially for common conditions like viral bronchitis and low-grade fever. These guidelines aim to prevent unnecessary antibiotic use. Next, regulation of antibiotics under Schedule H and H1. Antibiotics are listed under Schedule H and H1 of the Drugs Rules 1945, ensuring they are only available with a prescription from a registered medical practitioner. Drugs under Schedule H1 are also subject to strict record keeping with supply records maintained for 3 years. CDSCO notification for high-end antibiotics. CDSCO, Central Drug Standard Control Organization. The CDSCO has included 24 high-end antimicrobials under Schedule H1, mandating strict regulation and oversight to prevent misuse. Then goes an important observation: global cooperation to fight antimicrobial resistance. First one, National Center for Disease Control, NCDC collaborations. NCDC collaborations with global organizations and countries to address antimicrobial resistance, focusing on AMR surveillance, capacity building, and specialized lab testing. Notable international collaborations include: first one, India-US CDC partnership. India-US Center for Disease Control partnership focused on antimicrobial resistance surveillance, SOP development, SOP standard operational procedures development, and data management using WONET, World Health Organization Network software. WONET is the name of software, okay, with support of HAI, Healthcare Associate Infection Surveillance through ICMR and AIMS. USAID, United States Agency for International Development Collaboration, focused on strengthening antimicrobial resistance containment in 6 states. Next, Indo-Netherlands collaboration. Pilot projects in Andhra Pradesh integrating AMR surveillance with a One Health approach. Next, Fleming Fund, UK. Supported training of trainers on infection prevention and control, IPC, strengthening AMR antimicrobial resistance surveillance network in 3 states, and conducting surveys on antibiotic use in tertiary hospitals. And the fifth one, or last one, India-Denmark collaboration. India-Denmark collaboration. A recent technical collaboration plan to address antimicrobial resistance. These initiatives aim to address the escalating threat to AMR through collaborative efforts across multiple sectors. Additionally, India's pharmaceutical industry is vital in bolstering the country's healthcare infrastructure, providing further support to these antimicrobial resistance containment strategies. To be conclude this about the details of Nafithromycin antibiotic, we can set this in this manner. India's proactive efforts to combat antimicrobial resistance AMR through innovative drug development, such as the launch of Nafithromycin, alongside comprehensive national initiatives, underscore the country's leadership in global healthcare. The commitment to surveillance, awareness, and international collaboration highlights India's strategic approach to tackling antimicrobial resistance and improving health outcomes. With continued investments in research, capacity building, and partnerships, India is well positioned to drive meaningful change in the global fight against antimicrobial resistance and contribute to better health worldwide. So, this is a picture of Nafithromycin tablets available from the Wikipedia, I think. This is a picture of Nafithromycin tablet. And of course, do like, share, and subscribe. Whatever. Thank you so much.